Jaslok Hospital has taken a great initiative in healthcare industry by launching its AI-powered model. So my first question is, how accurate is the model in predicting heart diseases? Uh, my question is, how accurate is the model in predicting heart diseases?
Okay, Naman.
Yeah.
He will elaborate the help of artificial intelligence in detection and score system. Yeah.
Thank you, sir. So, AnginaX AI is an intelligent healthcare system that fits on top of every single doctor's office. So it's like it's powered by artificial intelligence. Has currently medical establishments are using Framingham heart study, common traditional biomarkers for cardiovascular assessment, which is hypertension, diabetes, smoker, tobacco, all those things. Those are not enough biomarkers. Science has advanced, so we have incorporated scientific research in this system. So it's not just an AI, it's a convergence of biomedical research, clinical science, precise medicine, and also artificial intelligence technology working together to precisely detect patient's insight before patient comes into the doctor's office. So how it works, when patient's data is entered in the system, doctor will have insight of that patient's silent risk, metabolic dysfunctions, other lifestyle patterns as well, not just the typical cardiovascular patient markers, but all of those, and provides detailed assessment, providing patients clear trajectory path where he is headed. And so if you think about a patient is normal today and tomorrow he collapses, this 24 hours, what if we stretch to 24 years? And doctor can see that, visualize that, this patient is heading towards up or down, and puts the halt on the progression of those cardiovascular disease and treats that, whether treatment is for lifestyle patterns or treatment is for medication or even other kind of treatment or further investigation. All those things happens way before symptoms arrive. That's how we're going to prevent life. So it's not really predicting heart attack, it's preventing heart disease way before symptoms arise.
What are the potential limitations or biases of the model?
Currently, we don't have limitation in the model because it's not for people, it's for doctors. So it's giving doctors some recommendation. Doctor can accept it or override it because doctors are the final judgment. They not take judgment call at last. So the limitation is not there because it's giving more insights to doctors. Doctors now have more power to assess that risk way earlier, and they can have they can save more lives.
What specific parameters does the model use to assess this?
So this model is, as I mentioned, there are clinical biomarkers. We have incorporated number of biomarkers in that system, and these biomarkers are, for example, I'll just give one example. Most of the time, your regular doctors are looking at cholesterol level, LDL, and when someone has an LDL, they provide you statin. Now, the science, last 10 years science says, the LDL has two kinds of LDL. One is large buoyant and second is small dense. Large buoyant LDL is cardiovascularly neutral. The small dense LDL is basically going under the surface of endothelial cell for the plaque formation, which is more dangerous. When you're prescribing a medicine to lower down your cholesterol level, your LDL level, you don't know whether it's large buoyant reduced or small dense reduced. AnginaX is going to help providing detailed assessment of your small dense, which is your more atherogenic for your plaque formation, for your cardiovascular risk assessment. Triglyceride to HDL ratio. So there are many different biomarkers. Currently, system is what if you go to doctor will see your assessment of 1, 2, 3, 4, 5 risk factors, and because of these factors, you have these symptoms, and will treat your symptoms. How AnginaX or any kind of AI works is combination of different biomarkers putting together in number of different patterns and providing you very personalized treatment plan for the individual patient's body and helping doctor that way before so doctor can have an early assessment. So it's very complicated. I can talk to you separately about this AnginaX, but it's definitely helping detect silent waste way before, and doctor can can see your patient way earlier.
Thank you.
Doctor, it is rightly said that prevention is better than cure, and this AnginaX model is a boon to the mankind. So I wanted to know, is it tried and tested anywhere else, like before launching it in India?
Look, I will say one thing. Our KPI for building this model, and obviously all the companies are going to do a lot of QA tests and test on different fields. We have tried a pilot and it worked fine. We have tried in Gujarat, in Zydus, we have tried, we're trying here in Maharashtra as well. But our KPI was whether it works for my mother. If it works for my mother, then it works for everybody. My mother was diabetic before putting her reports in AnginaX. The doctor of my mother is very senior endocrinologist, and he said everything is fine. As soon as my mother's reports were put in the AnginaX, there were a lot of changes. We found out my mother was in severely high risk without any symptoms. And those doctors who were treating my mother now changed the medication and prescriptions, and now my mother is taking those. My mother is not aware of it, but doctors are aware of it. So I would say there is no more bigger test than testing on my mother.
And after knowing the symptoms in an heart attack or a heart diseases, so the expenses, a lot of expenses involved. So how this model is going to be affordable?
Look, people work whole life and then save money, and at 50 or 40 or 60, they go and they have a heart attack and they do bypass surgery and all those things. All the money is wasted, life is wasted, family is wasted as well, right? When we build this system, we want to make sure that the reason we are starting with Jaslok has always took patient first approach. They're always on, they're compassionate, they're affordable, accessible, compassionate healthcare, and so working with Jaslok is also, it's people first approach, and AnginaX has the same mission, which is, our focus is people. And the cost of AnginaX that we have kept is 108 rupees.
Oh, it's very nominal.
And the reason we kept it 108 rupees is because so people do not have to dial 108 for an ambulance call.
Very thoughtful.
So my question is to doctor, is it suggested everyone should take this test?
I would say, to give you an example, during Vietnam War, lots of young soldiers died. It's a rule that anyone who has an unnatural death has to undergo autopsy. And when the autopsies were performed on those young people between the age of 22 and 30, we found that they had already a beginning of atherosclerotic disease, meaning they have deposits of fats and cholesterol in the inner linings of the blood vessels. So therefore, I would say that the process of prevention should at least start from early 20s. Time in the cave, they've been now finding out, maybe due to better detection, maybe due to better awareness, maybe due to the media helping to spread those disastrous news to make people aware. I think we are finding that younger and younger people are becoming victims of sudden cardiac death. So therefore, we feel that at least after the age of 25, there should be a checkup program.
Hello, I have a few questions. Firstly, it's regarding the AI model. I wanted to know how are you, how is the AI using its data? Like, are you guys going to use the real-time, patient history and everything for it to learn more and more about new way, certain diseases that might not get detected or certain high risk, which are even difficult for doctors to assess? And are you using just the patients, or are you using also research papers done by other people from other universities also? So are you using both of them or either or?
Alright. Over a period of time, we will be able to collect lots of data. There is a paucity of data in the literature on the Indian population. And it is not good to extrapolate the findings of Western countries to and apply them to our country, which is wrong. And therefore, when we will have those kinds of data, hundreds and thousands of patients, it will help us fine-tune our own parameters and then use them for the treatment. We will come to know what is normal in Indian population, what is abnormal in Indian population. We are, you know very well, India is the world's capital of diabetes. Highest diabetes in the world is in India. Now, so therefore, this will enable us to give an accurate advice and not to overtreat, not to undertreat.
And I want
Ajit, you want to add anything?
yes.
I'll add in the sense that the question you had asked, there are two aspects to treating a patient is concerned. One is the primary prevention, and the second is what is called as the secondary prevention. When you talk about secondary prevention, the person already is afflicted with the problem or the disease, and then we try to prevent any further problems occurring. Here we are talking about a primary prevention. That means the patient does not have any symptoms related to any disease. As far as we are talking about cardiology, so we are talking about cardiac problem. He doesn't have any symptoms related to cardiac problem. What we want to do by this thing, by the parameters, which includes not only a physical examination, weight, as I said, history and this thing, as far as the biochemical data, we want to collect and see as far as the established Framingham study data and the other data which are telling you that this patient comes into a category. Now many a times what happens when a patient comes in, we look at only one or two aspects of the abnormal parameter. We miss on to the other things. Now what AnginaX is doing is that it compiles you and tells you what are the things you look for. So in a minute it tells us what are the things you have to stress upon and what are the actions you need to take upon. That is the advantage of the AI additional as far as the management is concerned.
So my question to you is like you said it was 108. Yes, I didn't get the actual figure of the cost. The person who comes and does this takes this facility from you. Is it mandatory that he should be treated from your side only?
No, so patient can go anywhere where AnginaX is deployed, and we are working.
But there is only one you said is rightly in India by your side. Jaslok has this facility.
Yeah, right now, this program is for Jaslok. Jaslok is, we are partnering with Jaslok for that program. Jaslok is kind enough to, accept that affordable for patient as well. Prevention is not everywhere. You will